If you're starting out as a personal trainer, you might not have given much thought to which specialist route you'd like to take. In fact, you might not even know right now what we actually mean when we say specialising, let alone the different routes open to you. So in this short video, we're going to explore some of the more popular specialist routes that personal trainers take, although you should know there are plenty of other options also. What we're going to cover today is by no means exhaustive. A specialist personal trainer is essentially a qualified PT with extra knowledge, skills, qualifications and expertise, and this is usually over and above the entry-level qualifications that are needed to practice. Usually this knowledge and expertise is focused on the needs of a particular type or group of clients, like pregnant women, older adults or body transformations as an example. The key thing about becoming a specialist trainer, regardless of what the actual specialism is that you must be committed to developing a much broader and deeper understanding in that area. Of course, your qualifications are important because they demonstrate to clients, employers, and even insurers that you have the necessary knowledge and the skills to support these clients. So in this regard, qualifications take care of the formalities, but to be a real specialist, you need to develop an extraordinary level of knowledge and skills in your chosen area. Now, you might acquire this through ongoing technical reading, training, formal education, professional development workshops, or CPD as this is more commonly known. What's important to underline at this stage though is that any literature or training must be evidence-based. So reading health and fitness articles, blogs and other web-based content generally won't be appropriate unless it's research focused. To become a specialist trainer, you need to create such a gap between what you know and can do in your specialist area and what the everyday personal trainer knows and can do. And this gap needs to be glaringly obvious to everyone. In this scenario, not only will you be able to charge more for your expertise and service, but you'll also have clients coming from far and wide to see you. So now that we know what a specialist PT is, let's take a look at a few popular ways in which you can specialise. Perhaps one of the most popular routes PTs take is focusing on supporting pregnant women or those that have recently given birth. In this scenario, the PT would initially complete additional Level 3 qualifications, like the Level 3 award in adapting exercise for pre- and postnatal clients, for example. This qualification will educate trainers on the anatomical and physiological adaptations that affect women during pregnancy and beyond, and how to create safe, effective and restorative exercise programs to meet the mum's needs. Once this qualification has been achieved, they then continue to undertake further reading and CPD training to broaden and deepen their understanding of what pre- and postnatal women need. They may choose to find suitable literature and training designed for midwives, obstetricians and others involved in providing care for pre- and postnatal ladies. Qualifications are clearly important to demonstrate to clients, employers and insurers alike that you have the necessary knowledge and skills to provide a service like this. However, to become a true specialist, you also need to stay up to date with topical conversations that are taking place and key changes that might be afoot around evidence and guidelines. You'll need to keep your knowledge and skills sharp. Another popular specialism for personal trainers is working with older adults. The normal aging process brings about a series of complex changes which affect older people in a variety of ways and at different stages of their lives. A physically active lifestyle is known to improve the physical and mental health of adults of all ages, but especially so in the aging population. On the whole, people are living longer than ever before, and by staying physically active, they get to enjoy their senior years more and be independent. For older adults, their fitness training very often needs to focus more on functional fitness and less on other aesthetic factors like a slim waist, for example. So the goal here is usually to design a program that allows an older adult to better perform daily activities with ease. For example, like tying shoelaces, lifting and carrying heavy shopping bags, or getting out of a deep chair. PTs that want to specialise in training older adults will first need to consider whether this is the right pathway for them. They'll definitely need to be patient, empathetic, and enjoy being around older people. That's a given. And from a qualification standpoint, they'll need to initially complete a Level 3 award in exercise for older adults, but may then want to complete other training and professional development designed for supporting this population. Charities like Age UK are often a great place to source this. Other qualifications that would also benefit those wanting to work with older adults would be a diploma in exercise referral or a managing long-term health conditions programme. Many older people live with health conditions like high blood pressure, high cholesterol, low back pain and arthritis, amongst others. Very often they're also taking multiple medications which may affect the safety and suitability of some exercises. So having an understanding of these conditions and how the medications affect a person's physiology, exercise capacity and tolerance would be of great benefit to anyone wanting to work with older people. Older people usually have a lot more free time to spare, and so they're often much easier clients to find, especially during the day when everyone else is working. And as a group, they usually have more disposable income because they're often clear of those expensive living costs like mortgages and childcare, as an example. So if you like being around older people and you wanted to specialise, they represent a really attractive and rewarding group of people to work with. Working with people with long-term health conditions like obesity, diabetes, low back pain or arthritis is also an exciting and rewarding way for personal trainers to specialise. Usually this is done via some form of exercise referral or wellness programme rather than PTs working independently with clients that have been diagnosed with these conditions. Care is usually provided via a multidisciplinary team, which may include physiotherapists, community nurses, GPs, dietitians and of course personal trainers that hold an exercise referral or long-term health conditions qualification. The effects of exercise and physical activity are potent in terms of the health and well-being benefits that they offer. Many common long-term health conditions can be dramatically improved, if not reversed altogether, by performing an appropriate level and type of exercise alongside other sensible diet and lifestyle changes. This is the essence of exercise referral. In a scheme like this, the nurse and GP will take care of the medical side of the condition, including managing medications, and the dietitian will provide nutritional support if it's required. The personal trainer will typically design and deliver appropriate exercise and physical activity program and support with other simple lifestyle changes that can be made. Alongside the medical, nutrition and exercise services provided by an exercise referral scheme, there may be other types of therapy open to patients also, including talking therapies like cognitive behavioural therapy or counselling. There may also be help for patients with smoking cessation, weight management and alcohol reduction, and personal trainers working in exercise referral schemes will have the opportunity to get involved in such programs also. Exercise referral is as much about changing habits and behaviours as it is about exercise, and PTs will play an important role in supporting patients with this. Most exercise referral schemes are operated by local authorities, although a good number of them have also been contracted out to private and charitable organisations. If you're a PT who's keen to work with clients that really need your help and who present a more complex and challenging situation than your everyday exerciser, then exercise referral could definitely be for you. The final specialist route that we're going to explore in this video is the strength and conditioning pathway. Strength and conditioning is concerned with the design and implementation of specialist training programs designed to improve athletic performance. This performance may be for specific types of athletes like swimmers, sprinters, football or rugby players, or it could be simply for recreational participants that are keen to develop a higher level of physical fitness. While strength and conditioning may have its roots in professional sports, it's as popular now with amateur and recreational participants as it is in professional sport. With the rise in popularity of mass performance events like Tough Mudder, triathlons, duathlons, marathons and Ironman, for example, more and more people need the specialist coaching and programming to achieve peak physical performance that will allow them to compete these events, let alone competing them without injury. The CrossFit movement has certainly helped to accelerate the popularity of strength and conditioning, and there are now a number of similar functional training gyms and training studios like these across the country that embrace the principles of strength and conditioning. To become a strength and conditioning coach, PTs would normally need to complete a Level 4 certificate in strength and conditioning or equivalent. Organisations like the UK Strength and Conditioning Association or UKSCA also run their own workshops and accreditation programmes. This accreditation programme can be quite overwhelming for personal trainers without academic qualifications, like a degree in sports science, for example, which is why vocational routes like the Level 4 qualification have been created. The importance of strength and conditioning for athletes and sports participants of all levels is widely known, so the opportunity for qualified S&C coaches stretch far and wide. Athletic and triathlon clubs and running groups often need qualified and experienced S&C coaches to help their members stay race fit and/or to recover safely from any injuries or niggles. Many semi-professional and amateur football, rugby and hockey teams also employ the services of an S&C coach. There are also a lot of opportunities in professional sports, although it's important to underline that the competition for these roles is usually quite fierce and that aren't as easy to come by as those in amateur and recreational sports. Like any of the other specialisms though, having the qualifications is usually only part of the equation, and to succeed you need a passion and enthusiasm for continued learning, education and professional development. You really do need to be a subject specialist with your finger on the pulse. Hopefully you've found this information useful and you now have a better idea of how you can specialise as a PT if you want to. Hopefully you found this information useful, but if you do have any other questions at all, then feel free to reach out to our careers team who will be more than happy to help you.